Hello, this is Dr. Fraley. Today we're going to talk about how to begin integrating nutrition into an existing practice. So, for many of you, you may already be involved in a practice or have a practice. You may be a PT or a chiropractor or whatever. You already have a setup that doesn't really do nutrition or doesn't really have that as a significant part of your practice. And so, as you're going through this program, I have no doubt that you've already thought about how you think nutrition should look in your practice, what you'd like to see. Um, Now is the time to start integrating some of these things into practice. And so the whole point of this course is to give you a bunch of different practical steps to be able to do that. Because sometimes that's the hardest part. You may, after seeing a course like this, just see all kinds of pieces and all kinds of things you can do, and at the same time be overwhelmed with how do you go from where you are now to integrating all those things that you want. So that's kind of what I want to talk about in this particular class. If you have a practice, how do you start? What do you do? So, the first thing that I would suggest is integrating some aspect of the nutritional exam into all of your new patients, right? So, one of the things that happens in practice is if you have a practice, you have a flow, and your patients have learned that flow, whether you mean to or not. Whatever it is you do, that's what your patients expect you to do. And so change is always hard. It just is. People in general do not like change, no matter how good it is. And so you're going to get some pushback to some extent from existing patients because of introducing new things. It's just kind of the way it is. So one of the best and easiest ways to start is by integrating some of the aspects of nutrition to all of your new patients because they don't know it. And so for years, when I had new patients, I would do my full chiropractic exam and my full nutrition exam. Now the problem with that is if you take all the stuff you've learned at this course and try to incorporate that, all the exam proceedings, it's a time thing. You begin to run out of time. So it's depends on the volume of your practice and how much time you have. If you don't have a big volume practice and you have the time to do it, I would strongly encourage you to incorporate everything into all your new patients because one, that will get cemented into their mind the things that you are looking for, and that's a really good thing because for the most part when patients walk in, they have a symptom. They have a problem. My back hurts, my stomach hurts, I have migraines, whatever. And that's why they're there. One of the biggest things that you always have to try to do through your exam and your report of findings is transition the patient's thinking from a symptom is the problem to the problem is the problem and a symptom is a symptom of the problem. And that transition to say, hey, my migraines are a symptom of toxicity, nutritional deficiency, structural misalignment, emotional stress, so forth and so on, versus I have a migraine, you need to fix it. Getting them transition from a symptom based to a problem based mindset is, in my mind, the biggest thing that you can do to getting good patients. Because as long as they stay stuck in the I've got a symptom, you got to fix that symptom, then basically they're in it for symptom care, which isn't holistic care. That's not really health care. That's symptom care, and that's really not what I do, or at least what I want to do. I want to get rid of the problems as much as possible and let that resolve the symptoms. In many extent, for most symptoms, just taking a medication would be a faster way to get rid of the symptom. But the reality is, does that change the actual cause of the symptom? Does it fix the problem? And in many cases, it doesn't. So when you go in and you do your exam, and part of your exam is you're looking for nutritional deficiencies, you're looking for um, imbalances, you're doing things like, oh, it depends on what you have, like calcium cup test or nutritional surveys or whatever. it begins to get the patient thinking about things in a broader context. Now, for a lot of patients, they've been trained basically to get symptom care. And so they will be a little bit put out by the idea that, they're in because of this symptom and you're asking them about a broader context. Um, and for some patients, mentally, psychologically, they can't or won't make the condition between symptom care and cause care. And in my experience, those are simply not good patients. They're not really in the right office for a holistic care person because, they want that symptom care. And if you go in and try to get them actually healthier, they're going to reject that. That's not what they want. They just want a band-aid to fix their symptom. And maybe you can provide that and they're kind of sort of happy with that, but they're not going to stick around and be good patients long term. And they're going to come back with the same symptom because they haven't fixed the problem. And so, sometimes there's a bit of a give and take there where you have to sort of address the symptom a little bit as you educate them and work them into a more holistic mindset. Um, but some people, that's just not what they want. They want to come in, they want to get their supplement, they want to get their treatment, whatever, and walk out, feel good, not have any problems, and then move on. And most of the time, that's not really long term realistic. They develop those problems because there's a cause. If you don't fix the cause, they'll continue to develop those problems. Or maybe you can address one aspect of those symptoms, but if the cause isn't addressed, then those symptoms will manifest in a different way. So transitioning the patient from a symptom-based mindset to a cause-based mindset, that's the key for your exam. And that's why if you can integrate, no matter what they have, they come in with low back pain, they come in with neck pain, they come in with joint pain or muscle pain, whatever they have, if you can integrate your nutritional exam into that exam procedure, you can begin that transition to say, hey, you're more than just this symptom. You're a whole person. Everything, can affect everything. That's why we're looking. And for most patients, it establishes you as a better doctor because they don't get that anywhere else. They come into most docs' offices and they have a specific problem. They're going to examine them for that problem for lots of different reasons. One, it's more time efficient. Two, it's basically how insurance reimburses, and most medicine is insurance based. And so, if you come in with a knee problem and somebody's looking at your digestive health, you're not going to get reimbursed for that. Therefore, from a business model, it's not going to be done typically. This is where you can be better, you can be different, because for a lot of patients, the fact that you go in and you actually examine them, not just their symptom, will go a long way to establishing you as a healthcare provider versus a symptom relief provider. And you can even see that transition in today's society where a lot of healthcare is moving towards a kiosk-based system where you can basically plug in your symptoms to a computer and it will go through an algorithm and distribute an appropriate medication. And that's going to be more and more available probably in the future. And some people will really like that. And other people will say, hey, the computer's not actually examining me. There's no person to talk to. There's no connection. There's nobody who understands what's going on with me. This is just symptomatic relief. And so there's going to be more of a division where you have symptom-based care and holistic-based care, and you're being prepared to be that holistic-based provider who can do a much broader scale than a computer algorithm ever will. But again, you can only do it based upon the information you gather. So if you can gather that information in your initial exam, and you can present that information when you do your report of findings, at the very least, you can begin getting the patient thinking about things other than what their symptoms are. So, they may think their migraines are all genetic and they just need something to handle the migraine pain. But you do your nutritional exam, You can show them, hey, this is affecting your heart rate or your heart rate variability or your all these other symptoms or toxicity or whatever. We've done a lot of different exam procedures that you can integrate. This is kind of what this class is about. It's taking some of that information, uh, building sort of an ideal, and then building a minimum. In other words, if you could take everything that you've learned in this course and everything that you will learn in this course and build it into an ideal, hey, I would ideally do this. You want to have that where you have all your tools and all your exams and all your supplements and all your diets and all your detox plans and everything that you've learned. You have this as sort of this arsenal that you should be able to walk in and fix pretty much anything. And then you sort of have it as a minimum. Say, hey, you know what? Not everybody wants to take and put the effort into their health that would require. Therefore, what are the minimum things that I do? And so the way you generally learn this is you start off with the big picture. And in a big picture perspective, you're looking at just philosophically what is going to interfere with health. And you can kind of break that down into general categories of physical, some kind of trauma, some type of mechanical problem with the body, whether that's a tension-based issue on the liver, say, where that's where our visceral treatment comes in. So you have the physical component, then you have the chemical component. So either that's some kind of toxicity or nutritional deficiency, how that works out. Or there's a mental, spiritual, psychological component, which we're really not focusing on in this particular class. In this program, we're focusing on the chemical side of things. But in general purposes, the broad picture is, hey, you're not healthy because something's interfering with your body's ability to heal. That's why most people are there. They're not there because, they fell and they broke their leg and they want to, run a marathon tomorrow. There's sort of an intrinsic understanding that if you have an acute injury, you need to let it heal. Most people get that. It's just, I broke my leg 20 years ago and it still bothers me. Now they're going to come to see you because they're saying, hey, this is abnormal. Why is this happening? And you can kind of go back into a big picture to say physical, chemical, psychological, and kind of break it down into those categories as primaries. A lot of times they're overlapping. A lot of times there's more than one. But if you kind of big picture it and say, hey, big picture wise, where does this person fit in terms of what's interfering with their body's ability to heal? That's an important place to start. And that's where your exam comes in, because as you go through your exam, as you build your steps, you need to have some steps to evaluate at least those three categories. And that's kind of how brain and thinking should ideally work. You want to keep in mind the big picture. What are you trying to accomplish? What is your initial exam trying to accomplish? What's it not trying to accomplish? So what I want you to get with this is the main purpose of your exam is not to create a diagnosis. That is not what you're trying to do. That may be a part of what you want, but your main part of your diagnosis is to say what is interfering with this person's ability to heal. If nothing's interfering, if whatever is going on is healing at a normal expected rate, then you really don't have a whole lot to do. I mean, their body's doing exactly what it should, but presumably they're there because that's not happening. Something is interfering with their body's ability to heal. Therefore, you need to examine that can evaluate, is that because of physical things? Is that because of abnormal joint positions or abnormal muscle contractions or abnormal tension from ligaments and fascia? Or is it chemical because of toxic load, nutritional deficiency? Or is it psychological? Is there something emotional that is preventing this person from healing? And all three of these are valuable. And hopefully through this program, we're going to have specialty programs to address all three. For a lot of you, you've been probably dealing with the physical side of things. This being taught at a naturopathic school, a lot of naturopathy is based upon mechanical soft tissue um, problems. So if you've already got that type of a practice set up, there's sort of an expectation and a certain patent population that you're probably seeing that is more geared towards mechanical problems. How do you transition over? Like I say, one of the first things that you want to do is you want to incorporate part of your nutritional exam into all of your new patients and at least open the door. And that'll go a long way. Now, what part of the exam? If you can do it, do all of it. For no other reason than the fact that the patient realizes that you're taking better examination of them. And you need the practice. You need to do this a lot. You need to have enough of a volume of practice so that you can move on and say, go back to a big picture and take a person's history and say, hey, I need this part of the nutritional exam that's relevant in your case. At this stage, without that experience, you just need to do a lot of it so that you can gain that experience. Um, but again, take your exam, take all the little steps that you're going to end up doing. At some point, pull back to the big picture and say, what do I really, really want to gain from this exam? Okay, so the next way to integrate nutrition into an existing practice is as you buy technology. If you invest in an ultrasound machine or a heart rate variability machine or a heart sound recorder or whatever you do, um, use this as a screening tool. You need to practice with that machine anyway. So, offer a day, take a Saturday, take an afternoon, take a whatever, and say, hey, we're going to do free or we're going to do reduced priced exam using this technology and we're going to take appointments for it at this time. And just advertise it. And basically what that'll do is say you get an ultrasound machine and, one Saturday a week, one day a week for a month, you're going to do ultrasound screenings and you're going to do it at a time where it's not going to mess up your business. And you're just going to book a lot of them. As you do that, one, it's going to get the word out that you have that technology. And two, you're going to get the volume you need to be comfortable enough that you can charge for that and not feel bad about it. You need to have a certain amount of practice with it. So this really works out very well because it gives you a time frame to say, hey, I've got this new technology. I'm just learning it. I'm offering, reduced priced or free whatever screenings. And I'm going to do that for a month or 6 weeks or whatever, just so that I can learn. A lot of people will take advantage of that. They're already coming to you because they trust you. So as you're doing that, a lot of people will say, hey, yeah, I have I would want to know what this would tell me. You go in, you screen them, you practice with it. You can get a lot of volume with it. Now you've got that information to come back to the patient and say, hey, based upon what I saw, this type of nutrition or this type of whatever would be appropriate for you. And that gives you a way, it gives you a window in to take your existing patients and transition them to more nutritional approaches to things. But it also gets the words out to the community to say, hey, this guy's or girl is learning new things or adding new things. They've got these new tools. It's cool. It kind of gets you a almost a rebirth in what you're doing in practice because you're integrating new stuff. And in my opinion, that's really necessary for existing practices because I don't care how good you are at what you do, it becomes kind of stale. If you do the same thing for 20 years, it may be really good, but it kind of gets to be old hat. And people, just the way they are, they like new stuff. They like to have new technology, new tools, new toys, new things coming in. So you can do this 2 or 3 times a year. For me personally, I like to get at least 1 or 2 new technologies in the office every year, and this is exactly the way I do with it. I'll just basically have times where I'll start screening all my existing patients with the new technology, and then that opens the door to have a conversation. And a lot of times, at least as I first start integrating, I'll just do it for free. I'll say, hey, this is something I want to learn. Would you let me practice on you? And people have no problem with that. They would love to have you practice on them. So you can do that, and then they're interested, and then that opens the door. So it's a really easy way to accomplish both increasing your own education and competency in using stuff, and getting patients that are already existing interested in a new side of nutritional care. Okay, so the next way to start integrating nutrition into an existing patient population is really just on your initial subjective experience with the patient when they come in. If you have a more soft tissue, neuromusculoskeletal type of a practice, you're going to find that patients will come in and they have a laundry list of symptoms. Their ankles hurt, their knees hurt, their hips hurt, their low back hurts, their neck hurts, their shoulders hurts, their elbows hurt, their wrists hurts, and nothing's happened. They haven't fallen off a roof. They haven't gotten in a car accident. There's not a good reason for everything to be hurting, right? And so logically, rationally, um, why is that happening? In all actuality, at least the way I look at it in my practice, is you've got multiple things going on with no reason. It's probably nutritional. If you've got chronic things that aren't healing, there's probably a nutritional component to it. So, using that initial subjective intake for patients is really, really important, um, both for the fact that for some of these patients, they're frustrated because they're coming in and they're still having symptoms, and they wouldn't be coming in unless they were making progress with you. And maybe they're making progress on a normal scale. You'll have to make that call. But maybe they're not making progress because there is a nutritional component that's not being addressed, and so they're sort of stalled in their care. Where if you were able to do some things to reduce toxicity, reduce inflammation, and improve nutritional availability, they could take that next step. So it's a very natural transition. But for existing patients, they have certain expectations. They expect when they come in and they give you that laundry list with their symptoms, then you're just going to go through and put your hands on and address every one of those. And so to transition their thinking from, hey, I need you to massage, adjust, stretch, whatever, this area, versus, hey, let's look at doing a cleanse, or let's look at doing some supplementation. That is a little bit of a disruption to their expectations, but it's necessary to do. It really is. Like I say, in my practice, if they come in, if a patient comes in and they have pain in multiple different areas, especially if they've been coming for a while, for a new patient, you have your exam, your report of findings, and a certain general timeline that you and they have kind of talked about as far as expectations for what's going on. But for existing patients, for people on a maintenance plan or a wellness plan, if they're still having symptoms and you're not addressing the nutritional side of it, as they give you those symptoms, um, as a practitioner, it's frustrating because you've done your job. They're way better, but they're still airing complaints and issues and that kind of stuff. For the patients, the same thing. They're paying money. They've gotten better. That's why they're in front of you, but they still have XYZ symptoms and issues. Maybe continuing to do the exact same care isn't as logical as doing something different. And that's very easy to say, hey, you've made this progress. We're kind of plateaued here. Let's add some, fill in the blank kind of nutritional support and see if we can kind of get past this plateau. And a lot of patients will be up for that. Not everybody, but a lot of patients will be up for that. So the other thing that you can do, if you already have an existing practice, is you can start integrating routine cleanses. This is an easy way to get people into a nutritional mindset without big commitments, without taking a lot of your time and effort. If you're not ready to put in exam procedures and you don't have your initial stock of supplements, but you want to start using some of this, super easy thing to do. What I would suggest for yourself, do a cleanse, do a 21-day cleanse or whatever, and talk to your patients about it. Tell them what's going on, tell them how you feel. That'll get some interest. And then just print off some toxicity questionnaires. I'll have some of these available for you in the resource section of the class. And just put them in your waiting room or put them in your lobby and say, hey, fill this out. They're pretty short, and then they can score it, or you can score it. And then just talk to them. Hey, the toxicity questionnaire says that it's getting kind of gunky in there. I just did a cleanse. I feel way better. Why don't you take 3 weeks and do a cleanse or whatever time period you use, and just see how you feel. See if that doesn't start to resolve some symptoms. I've never ever had a person do a 21-day cleanse or something like that who did not feel significantly better when they were done. And so that's a really, really easy way. And what's nice about the questionnaires is that it gives you a talking point with the patient. But if you make it available, a lot of times the patient's spouse, the patient's family or whatever, they'll do it too. It's just kind of something to occupy time where they're sitting and waiting around, and they'll be interested. And then you can start getting the family integrated into nutrition, and that's even better because it's way easier to make long-term nutritional changes when the whole family is involved. Okay, so those are basic steps if you have already existing practice. First of all, integrate nutritional exam proceedings in all of your new patient exam. I don't care if they come in with a sprained ankle or whatever, put some aspect of the nutritional exam or all of it if you can into the patients, right? As you get technology, as you start building the tools that you want to have for your practice to use it. Do some screenings. Don't be so concerned about your return on investment for those machines up front. It's way more important up front that you introduce it to the patients and that you get the experience using it so that you are competent and confident in what you're doing. Then start charging, then start doing some things. Or charge, but maybe charge, a reduced fee or something like that. Whatever you got to do, don't buy some piece of equipment and let it sit on the shelf or sit in a room. Got to figure out a way to make sure that you're using it regularly, because that's what's going to give you the experience to say, this is when I need to use it, this is when it's appropriate to use. Use your equipment. Next thing, again, when patients come in with a laundry list worth of symptoms and no reason why they should be there, or they've plateaued and they've gotten stuck and they're not making any progress, when they're telling you this, make sure that you integrate in nutrition. I've been there. You get frustrated with patients because they're like, they come in and they're on a 10 to 10 pain scale and they're dying and they're crawling in the door, and you work on them and now they're at a 3 on the pain scale and they're still unhappy because XYZ still hurts or they have XYZ symptoms. And in your mind, you're like, daggone, you're way better off than you were a month ago. But they still have the expectation of, I want to feel 18 again. At some point you have to say, I need to add another layer. I need to take another step for this patient if they want to get better. And this is the time to tell them that. So if we're not getting there, then we need to add something else. Let's look at nutrition. And that's when I do one or two things. Either they really are serious about their symptoms and they're saying, yeah, let's do it. And that's going to get you a transition nutritional patient, or they really just like the attention they get. They like to vent how they're feeling. They know that there's problems with diet and lifestyle and stress and so forth. And so they're not there as far as really wanting to make a change. And so that kind of tells you something too, because you can only do so much. And if they're not really going to make that change, then you don't have to take it so personally. But if they really are willing to make the change and they really want to do better, this program will give you such a better set of tools to be able to take them to that next level. So either way, it's good. And then again, If you don't have the equipment, if you don't have the supplements, if you don't have the preparedness, just simple, basic, do a cleanse, put out a test, a questionnaire, um, have patients fill it out, have patients' families fill it out. Look at it. If they have a measure that say, hey, the toxicity scores are high, you're probably due for a cleanse. Lots of people never heard it. Lots of people have never done it. The toxicity questionnaire will give you plenty of ammunition to say, hey, this is appropriate for you. Get them started doing cleanses. You can buy those cleanses and know that you have them sold, and that'll start giving you some revenue. Start making those investments in other parts of nutrition. So I think between those avenues, you'll have plenty to apply to be able to get nutrition started in your practice. So we'll talk to you later.